I'm Arika Patneaude, and I'm affiliated with Seattle Children's Hospital, so I'm the director of bioethics and palliative care. I was previously a palliative care clinician on the team, and I'm also an ethicist. The other piece that I do is that I do outside of Seattle Children's is I'm an anti-racist consultant or anti-racism consultant. So I live and breathe anti-racism work and paradigm in everything that I do, personal, professional, because I have to, because I'm one of those people that I really believe that if I can, I must. And it's almost like a spiritual calling for me. I was born into a social justice family. My parents are an interracial couple. My dad is Black and Indigenous, and my mom is a white Jewish woman, Ashkenazi Jewish woman, who was born and raised partially in New York and in Tucson, Arizona. And my parents met during the civil rights era, and it's almost like, we talk about, or I talk about often, how we live and breathe white supremacy within our society. But in my family, I lived and breathed social justice from the very beginning. And then the other piece is when I was 2 years old, my baby brother died. And this is the first memory that I have was he was born at 23 or 24 weeks. And he was considered at that time, it was 1971, 72, he was considered not viable. And he died. And he was, my parents were allowed to bring him back to our farm. I grew up on a 308-acre farm in Southern Oregon, and he was buried on our farm. And so he always was a part of my existence because me and my other younger siblings played on the rock that was over his burial site, right? And we talked to him and we knew his name, and he was always a part of our family. And continues to be. My own children know about him. And so kind of those intersections of my identity is how I got involved in this work. And for me, I don't feel like it's work. I feel like it's a lifestyle. I feel like it's a calling. I feel like it's a spiritual connection that I have with the world. And it's really important to me that folks who have been oppressed, in whatever way that works, receive equitable health care. And honestly, it's a hill that I'm willing to die on. People talk about, like, what are things that you're willing to, and this for me is one of those things.